We thought for this workshop we'd bring together a group of people representative of policymakers, clinicians, researchers who've been working within this context and have lived Indigenous experiences or practiced in clinical settings, and look at what are the values and context, what are Indigenous values that inform good stewardship of our health system. Is it similar within circumpolar regions, be it United States, Canada, Norway, Finland? Are there shared experiences? Are there differences? And then from there we can go forward. There's also a recognition that traditional academic methodologies may not be completely responsive to understanding how these values then carry through our health system and making improvements. So we're also looking at participatory methods and how we can recognize the knowledge where it is and within the communities. We've brought ourselves to this nice setting in an environment that is very rich with the traditional knowledge and spaces that allow sharing of the knowledge and ceremonies. And one of the elders present at the workshop has had ceremony every morning that we've been able to participate in. And it puts you in a space that's different if you're in an academic workshop environment down the hall from your office.
There was a prophecy made a long time ago, and all tribes know this. Is that time when things are going to turn around. Is the time, they say, when the eagle lands on the moon. In 1969, that's when the eagle landed on the moon. So that was the sign of when people began to turn around and began to rediscover themselves as Indigenous people. And we've come to a time where we are beginning to really, with non-Indigenous people, we are beginning to really work at a life that should have been when Europeans first made contact with us.
As I think about how healthcare is delivered, often I hear from the people that I work with, in the various communities and in the urban centers, that they don't feel like what was there before was at all what they wanted, but it was what they had. And now we have this opportunity through a lot of hard work, generations of struggle, of a strife, to do something in a different way.
I can see it. Every time a Sami patient comes to me, it is different. The communication is different, how things are being said, and what kind of things are valued there are different than when a Finnish patient comes to me.
I think the biggest issue in Norway is to really get the knowledge out that Sami need some special care and that they are a little different from the majority. Norwegian people think that Sami are the same as the other Norwegians, so they don't need special health care. But in our research we have shown that the Sami need something extra. For example, they need the healthcare takers that understand that they have another culture, and of course they have another language, the Sami language, and lots of Sami need to have a GP and nurses that can speak Sami and understand their background. Because some patients I've been talking with, they don't go to the healthcare center because they say the people there don't understand us.
If we look at the health system more broadly, what are some of the values that come to mind. And what I'm going to do is give everybody pieces of paper, and you can try to write 10. We're going to begin to categorize these now. Indigenous knowledge, and then you can go like this: understanding, respect, with different world views. And then you can begin to see, well, respect fits under that. Is a similar value. Are the headings broad enough? And then we can perhaps put words to what are shapes right now and what we might call the overarching piece, and that's something we can do collaboratively.
So this is a very hard conversation to have, naming these things that are almost inherent in your way of being, but at the same time, how do you communicate with another person from your same place or another place on what you see as reality and as the future?
We did translate our core values into French, into Inuktitut, into Cree. I'm trying to think the other languages, but it was the other translations that I participated in. It's so hard. It's so hard to, stay true to some of the intentions, because our language shapes and changes the essence of how we share things.
These sentences, they sort of brought together many things in one sentence. First was high quality, culture sensitive healthcare services in our language. Community care established by Indigenous peoples based on the needs, way of thinking and holistic perspective of the Indigenous peoples themselves. Local traditional food and nourishment is really very, very important.
When all that is put together in my language, just simply we refer to this as Dinachania. That's the best I could say, Dinachania. It is descriptive of everything, our history, our spiritual laws, environmental laws, political laws, economic laws, of how people are to live together, to interact, protocols of living in families, in communities, and with others, and so Dinachanya is, for me, it's the best word that I could use to describe this.
It was quite interesting to see how the themes emerged, and be it a Sami experience, an Inuit experience, First Nations. There was quite a bit of overlap, and people had different color pens, and you could see all the colors were emerging from some core values that people hold.
The first thing that I come away with is I am not alone in being from an Indigenous people, serving them. I'm not alone in struggling to use methodologies that don't feel appropriate. I'm seeking to reinvent or redesign those methodologies to suit the people that I work with. I feel encouraged that there are others that have similar struggles and have overcome them in different ways. We share a language of the heart as well as a language of the mind and mouth.
To partner with other Indigenous people from the global circumpolar regions, that's huge. That is because we're all affected around the globe, and sometimes we're working in isolation, sometimes we're duplicating work, and we need to continuously be coming together to find out what is needed, what are we missing, what is done, and more so the extent of how we can find solutions